Good evening, everyone. It is my pleasure to be here this hour. My name is Abdurrahman Lukman. I'm a community pharmacist, public health advocate, and also I serve as a lecturer at Lincoln University, Unsuk campus. Before we begin, I'd like to ask you a few honest questions. You may not be able to speak, but just give us a reaction. Have you ever taken any extra dose of medicine because you wanted to recover faster? Number two question. Have you ever forgotten to take your medication and then decided to take a double dose the next day? Then, have you ever used medicine simply because a friend or family member said it worked for me or it worked for them? Or perhaps, have you ever stopped taking your medication as soon as you started feeling better without completing the medication? If you answered yes to all those aforementioned questions, then you are not alone, and this webinar is for you. These are common medication practices that many people don't realize can actually lead to what we know as serious health consequences. The good news is that most medications error, I will tell you, and I will say to you, I will tell you for free that they are preventable with the right knowledge. Medication saves millions of lives every day, but when used incorrectly, it can also come or cause what we know as a harm. My goal tonight is to equip everyone with what we know as a simple, practical, and evidence-based tips that will help you and your loved ones how to use medication safely and confidently. I want to tell you to sit back, stay engaged, and don't hesitate to participate. Together, let's make medication safety everyone's responsibility. Thank you so much, Dr. Chidema, for having me this hour.
All right, that's fantastic. Thank you so much, Pam Lukman. You have done an amazing job, easing us into this conversation.
My pleasure.
Let's start with the basics, Pam Lukman. These medications are harmless because they can buy them easily. So why should an average person be concerned about the
Wow, thank you for that fantastic and important question. Well, many people believe that if a medicine is easy to buy, it must be completely or 100% harmless. Easy to buy means like drugs that you can easily go to pharmacy outlets without using prescriptions, like over-the-counter medications. But unfortunately, that is what we know as a dangerous misconception. The truth is that every medicine has benefits, but every medicine also carries what we know as a potential risk if used incorrectly. As a pharmacist or as pharmacists, we often say that the right medicine in the wrong person at the wrong dose or at the wrong time can become harmful, even with just the over-the-counter medication or even with common medicine. For example, like your painkiller. Example, let's talk about diclofenac, ibuprofen, talk about your cough syrups, talk about your antibiotics, your herbal product. We can easily go to pharmacy outlets and get all these aforementioned medication easily without prescriptions. But they can seriously cause serious adverse effects if not used accordingly. And all these can cause allergic reactions, they can cause drug interaction. The average person should be concerned about medication safety because medicines affect the body in powerful ways. taking the wrong medicine, using someone else's prescription, stopping treatment too early. This is common to most people, like taking antibiotics, or combining or mixing medicine without a professional advice. This can lead to what we know as a treatment failure, or if taking antibiotics without prescription can also lead to what we know as a antibiotic resistance. And this not only antibiotic resistance, this can always lead you to or make you to land in the hospital, or like hospitalization. And I'm very sorry to say, in some cases, even loss of life. Medication safety is not about being afraid of medicines. It is about using them wisely. That is why pharmacists are always there for you to ensure every medicine is the right drug for the right patient at the right dose for the right duration, while we are minimizing the harm. There is a principle, or what we know as a Paracelsus principles, that say all substances are poisons. The right dose differentiates a poison from a remedy. So, ability of you to be able to take your drug or take the right dose, that is when you'll be able to achieve the remedy. Inability to take the dose correctly, then the drug or the medication you are seeing are just harmless or just ordinary paracetamol. They can actually become a poison to you, become something toxic, because you don't take the right dose. So my message to everyone is simple. Don't just take medicine because it is readily available. Take it because it is appropriate, and always seek professional guidance or advice when you are in doubt of any medication. And medication safety is not just for healthcare professionals, it is for you and I. Thank you so much once again, Dr. Chidima.
We want to know what are some common medication mistakes that you as a pharmacist you see in your practice?
Oh, thank you so much. That's an excellent question. There are quite a few. As a pharmacist, I will tell you for free this evening that the four most common medication mistakes people make. One, self-medicating without professional advice, or self-medication without professional advice. Many people diagnose themselves, and these days, I've experienced this a lot in the practice. We have a lot of Google patients. They have downloaded and Google search everything before they even visited healthcare provider. We have them a lot. We are all guilty of this. So, because you rely on recommendation from friends, you rely on recommendation from family, you know, what work for one person may not be safe or effective for another person. For example, this really common in our society. Buying anti-malaria drugs whenever you develop fever without confirming that it is malaria. Fever is not a disease, but a symptom to a certain disease. It's a symptom, it's not yet a disease. So somebody say, oh, I already Google searched, I know how my body and I know how I used to feel when I have malaria. Just give me anti-malaria. They even mention that, give me Lonart, give me Amatem soft gel, They even say it with steez, But how? Anti-malaria drugs, malaria, you cannot start treating malaria without proper testing. Having fever or having cold does not warrant to start treating malaria if you have not done proper testing. So all of this boils down to what we know as a self-medication. That's number one most common medication mistakes. Number two, I will also mention not following the prescribed dose or the duration. Some people stop taking their medication as soon as they feel better, while others take more than prescribed medication, thinking it work faster. Both practices, whether you stop it when you discover you feel better, or you took more than prescribed medication, both practices can reduce what we know as treatment effectiveness and increase the risk of what we know as a complication. This common to ibuprofen, diclofenac. Ibuprofen are non-steroidal anti-inflammatory drugs. Most people will take it during when we have a kind of pain, but these medications are there. A doctor, a pharmacist, or healthcare provider instructed you to take 2 tablets or 1 tablet, take for instance. You are meant to follow the instruction strictly, 100% drug adherence and compliance. Some people feel like, oh, 50 milligram, I can increase the dose to 100 milligram. You are not doing good to your health, you are causing more harm. And you think these tablets will work faster because you think because you thought you have taken more than one. You want to achieve a quick or a faster response. No, you are causing more harm to you. So if anyone here listening to me now, you have been doing this and it's your usual practice. So right after this discussion, this webinar, I urge you and advise you to stop practicing all this because you are causing more harm to yourself. The third common mistake people do make or medication mistake is sharing prescription medicines with others. This is common to our parents. They get a medication from Mama Chineye, and because the medication work for Mama Chineye, so Mama Chineye will transfer the medication to Mama Ngozi or Mama Emeka. So Mama Emeka will start taking this medication. It is totally wrong because prescription medicines are prescribed based on an individual's specific condition. Like your age is different. Mama Chineye age is quite different from Mama Ngozi or Mama Emeka. So Mama Chineye medical history or medication history is quite different. And some other medication, sharing them can actually be dangerous and may delay the correct diagnosed treatment. So take for instance, somebody taking anti-diabetic drug. This common one that people do often use here, where we have glucophage, taking it, and then you feel like, oh, Mama Chineye also complained of increase in or sudden increase in blood sugar level. Then you thought of sharing that same medication with Mama Chineye. It is wrong because Mama Chineye blood sugar level increases that particular point in time. It could be as a result of the food or the drinks she took at that particular point in time. So maybe with little workout or little exercise, that sugar level will drop. You don't allow Mama Ngozi or Chineye to do proper testing. You started sharing your own anti-diabetes drug, and that can drastically lower the blood sugar of whosoever you have shared the medication with. So that act is also wrong. Sharing prescription medicines with others, it is totally wrong. Another common mistake that people do make, I will say the last that I will mention here, remember I said 4, it's mixing medication without checking for interactions. Mixing medications without checking for interaction. Combination, science students, you think like you did chemistry, you just want to combine them together. So people often combine prescription medicines with over-the-counter medication. Over-the-counter means drug that you don't need prescription to get. So they even combine it with herbal remedies or dietary supplements without consulting a healthcare professional. This can lead to harmful drug interaction unexpectedly and unexpected side effects. Take for instance, somebody taking antibiotic with antacid. Antacid like your Gestid, your Gaviscon. If you take antacids, if you like Gestid, your Gaviscon and other example of drugs in that classification, if you combine them with antibiotics, believe me, that Gestid will affect the absorption of antibiotics. It affects the antibiotic. That means antibiotics will not be able to produce its effects. Another example here, mixing medication together, one will affect the other. is people taking, and this common to ladies, combining antibiotics with what we know as contraceptives, no, your emergency contraceptives. When you combine these together, then you have affected the contraceptives. If you take any antibiotics together now, you have affected the contraceptives. It could be your post P, it could be your post too. You combine them together, then the contraceptive will not be able to produce its effects. You have affected it. Then if you are the type that combine antibiotic with contraceptive together, I want to tell you, anytime you do that, congratulations to you and start preparing for your antenatal, because this will not really produce its effect. The good news is that mistakes are largely, they are largely, but they are preventable. Before taking any medication, ask yourself three simple questions. Please, before you embark, you start taking any medication, ask yourself three good questions. One, do I know, not me, you, do I know why I'm taking it? Do you know why you are taking it? Do I know how to take it correctly? Do I know what side effect or interaction to watch for? If the answer to any of these is no, that is the perfect time to speak with your healthcare professional, especially your doctor and your pharmacist. Remember, medication safety is a shared responsibility, as I said earlier on, and pharmacists are always available to help you use your medicine safely and effectively. Thank you so much once again.
Wow, thank you so much, Pam Lukman. You can see or see the nugget that Pam Lukman is giving to you for free. Instead, he has told us that he's a lecturer in university, so people pay good money to get all the products that are giving you here at Dr. Care 47 for free. Thank you so much, Pam Lukman.
My pleasure.
I'm sure that some of us are guilty of some of these mistakes, and I will not even lie, as a doctor, sometimes, before I became a doctor, I pay my mom, I will pass her here and say, it's guilty of one of the mistakes. That's like you buy maybe, anti-malaria or antibiotics, and it's for all the children. No matter your age, your weight, anything, if you have malaria, even if it's not confirmed with malaria, it's remaining, I can't take that anti-malaria that's still remaining. There's no, confirmation test and all that. So, and that's very, very wrong. We have to check ourselves before we move on to take drugs. All right, so like I said earlier, we are going to play a quick game where I'll be reading out some statements, and Pam Lukman will tell us if it's a myth or a fact, and will tell us why this is so. So the first one is, if a medication is sold without prescription, then it's completely safe.
Completely safe? That is a big myth. Just because a medicine is available without a prescription does not mean it is completely safe. I used paracetamol as an example earlier. Like over-the-counter medicines, they can still cause a serious side effect, a serious allergic reactions, or interact with other medicine if used incorrectly. Paracetamol is completely harmless because it is sold over the counter. You don't need prescription. Say paracetamol, give me paracetamol, give me M&B. Quite alright, they sound so harmless. However, taking more than the recommended dose can cause serious liver damage. When you take overdose or you took overdose of paracetamol, we start looking for antidote, and antidotes are quite expensive. We start looking for acetylcysteine. Oh, our mother those days is okay. Let's give palm wine. Some people even go ahead and give kerosene. But this information are needed before everybody will engage in unusual or unethical or professional practice. This taking paracetamol more than the recommended doses can lead to liver damage and itself, and what we know as a liver failure in some severe cases. So my message to you here now is that easy to buy does not mean risk free. Always use